And so my last question then is around physician involvement. Of course, there's many facets to delivering care. And I want to get your take, maybe starting with you, David, and going around on how do we bring physicians into the process? How do we manage accountability of physicians, given the complexity, the cultural complexity of delivering care? How do we bring them into event reporting? How do we manage the physician component?
Well, clearly today in healthcare, there's a disparity, particularly when more and more physicians are being employed and they're becoming part of the system. But when physicians are trained to be autonomous agents out, individually dealing with their patients, we haven't taught them about system safety. We haven't taught them about being part of a system. Healthcare organizations, hospitals have been going down this path, and nurses have managers. They're a part of an organizational structure. I think what we see in acute care setting in particular is the physicians have to really retool what it means to be a physician and say, I'm going to be part of a system that produces good results. Raising their hand and reporting and believing that's a valuable thing to do, and we get feedback and that it's helpful is a transition for physicians. We have the whole tort liability system, medical malpractice system. It's not much of a help in getting the physician to raise their hand. But understanding the power of good system design and understanding, we saw this in the pilot community of proceduralizing, and I know we're not trying to create cookbook medicine, but we do have to say there are times when there's a best practice. And how do we learn what that best practice is and bring physicians onto that, just like we will pharmacists and nurses. And so I think there is a long road ahead of us, and I think it's transforming just the core. I think this comes to you, Hal, as a physician, is how do you see that transformation occurring to where, when you started practice to where we are today and where you see ourselves 10 years from now, how does that transformation occur?
Well, taking a note from aviation, Helmreich has written about the very personal characteristics of people in that field that let the pilot take on what would be a challenging task, is their own personal estimation of their capabilities. And so that's a very positive part of how they operate. But it also, the flip side of everything we do is there's a downside, and the downside is that very confidence in being able to tackle the tough job also creates sometimes an unwarranted overconfidence in one's own ability and a lack of ability to see weaknesses in performance as readily, because it's very protective to be able to do the job, to feel confident and able to do it. So this idea of getting past that is a challenge. Part of it, again, is my own self-image, but again, it's also the culture of closing ranks, both my self-image, my department's self-image, the organization's self-image. Again, we get back to trust, that people are going to understand how important what we're doing is, and respect the value of that coming forward, but also understanding, as Dave said, some more of what the system function is and how we play a role in that. And that's pretty much, that's not been medical education. In fact, the AMA has an undertaking in which looking at what we do in medical school training as early as medical school, and understanding about patient safety, understanding the system functions, that's early on. And one of the problems is if you start in medical school, they're now going to be coming out into an environment where that hasn't necessarily been taught. And so there's going to be a difficult transition there, that you have to have the medical student move into an environment that's also supportive of the information they got in school. And that is a process that people are aware of and are addressing, but again, dissemination is a hard process.
I don't think I have anything to add. Hal's comment was one that I was going to make about training and orientation into new institution and training in medical schools and specialties, et cetera, that you've got to, you can certainly try to get the most senior guy in the department, Professor Twitchett, but you better be starting to figure out a way to target those that are coming up through as early as you can get them to, even if they're not coming into an environment where these things are being implemented. At least they understand what it is, and when somebody starts to talk about implementing, they'll have a receptive audience.
Yeah, and this other side of it is this, we've identified, I've seen it, very powerful effect of a physician champion. Somebody who really takes this on, and uses the information and makes it part of whatever unit they have influence over. And it's a striking difference if you have a physician champion, how things move. And with a lack of that, a person who's taken that on and acts as a thought leader, it's a much slower slog.